We're good.
All right, we are live. All right. My future is bright. I got to wear sunglasses. Hello, everyone. Welcome to the Fixed Blood Sugar webinar. Or as my wife said earlier, weaponar. And I'm thinking, we are weaponing against blood sugar, We're
That's
positive
good.
forces of good, huh? Yes. Weaponizing. That can be taken wrong as well. But anyways, hope everyone's doing well. Thanks for joining us today. And looks like people are hopping on. So welcome. Say hello. Tell us if you voted or not today. Put it in the chat. And tell us what it was like. I voted this morning. Waited in line for 45 minutes, which was probably 10 times longer than I've ever had to wait in line to vote in my small little township. But it was good to see. The weather was nice and lots of friendly, smiling faces out. Thankfully, it wasn't last week when it was like 32 degrees and snowing. So I think we're going to get really good voter turnout. It looks like weather's good all across America. So yeah, hopefully you guys are taking advantage of today's election day and voting if you haven't voted already. I heard on the radio this morning, 100 million people have already voted early, which is amazing. Like that's close to like the number of people that voted all of last 4 years ago. So it's good to see America getting out and getting their voices heard. It's one of our greatest freedoms and rights as citizens here. So yeah, good stuff. Welcome everybody. Dr. Saunders, good morning.
Good morning. I voted last week because in California, all we get are mail-in votes. So,
Really?
but I didn't mail it in. We have drop boxes around town. So I voted and put it in the drop box. And then afterward, I wanted to take it out and change it up. Just
Really?
like when I was in school, I would hand my test in and go, oh, I want to change something after I handed it. Too late.
Yeah, I wondered about that. Like, what if someone voted and then something major happens? Like, wait a minute, I don't want to vote for that person anymore. So, that's what it is. So, Leslie, good morning.
Hello, everyone. I'm voting this afternoon. I've been waiting for my husband to get off. He had 3 calls this morning. So after this, we're voting.
Excellent. All right. Well, good stuff. So today, Leslie, tell us what we're going to be talking about today.
All right. Okay. So today, type 3. Are you guys familiar with type 3? This is kind of something new. I had to ask Dr. Saunders exactly what it even meant because I'm hearing it more and more. We have a lot of questions about brain health in general. So I'm just going to let Dr. Saunders talk about this. What is type 3? What do we need to know? And are we more at risk if we already currently have type 2?
That's interesting. Type 3 is not yet a real thing that's caught on with everybody. In other words, you're not going to go into a neurologist. They're going to say, oh, you have type 3. Because right now it's more of a researcher thing. A lot of people who do research on Alzheimer's and dementias, and they say, gosh, there's this really big correlation between people with this type 2 and then getting dementia. And then there are some people that don't even have high blood sugar. They have like normal blood sugar, so they don't really have type 2, and yet they're starting to get dementia. And when they test them, they find they're insulin resistant. So they want to call it type 3 because it's a sort of a different manifestation of the illness of insulin resistance, or what we would call type 2. But they don't have to have high blood sugar all the time. In fact, many of them don't, but they do have insulin resistance. So it is a metabolic problem, but the brain is especially sensitive to changes in blood sugar. The brain is constantly needing sugar. There's no way around that. You can't say, oh, I'll just use fat for a little while in my brain. That doesn't work. No, if you're not eating sugar, you have to be making sugar, which means you're taking protein, and the protein goes to the liver. Glutamine goes to the liver and is made into sugar, glucose, which then goes to your brain. Your brain's happy because your brain needs the glucose. But here's the funny thing is you could have a ton of glucose. You're drowning in glucose, and your brain is going, hey, I need some glucose. I'm starving here. And the brain shrinks down and it doesn't work right. And there's certain areas of the brain, excuse me, certain areas of the brain that are more susceptible than others, like memory and cognition, your ability to put complex ideas together, for example. So that we want to call that type 3. But really what's happening is the brain is starving. Doesn't make any sense, does it? Think about it. Wait a minute. My blood sugar is always over 200 and my brain needs that blood sugar. Why is it starving? It doesn't make any sense. And here's the thing. Not everybody gets this, but those who are susceptible, there's a protein in the blood-brain barrier. Glucose, sugar, cannot cross the blood-brain barrier. It is stuck in the blood vessels. So you can measure the blood and you can have a 300 blood sugar, or if you're in Canada, it could be a 10, or 11, 12. And blood sugar can be super high, and your brain's going, I'm not getting any of that. And so there's a lot of things that happen surrounding that. Well, let's ask the question, why not? Because it's there. Why can't the brain get it? Well, those proteins that pull the sugar into the brain from the blood vessels have to, in order to get the sugar into the brain, there's a protein that has to pull it in. There's no other way. And when you have high blood sugar or insulin resistance for a long period of time, what happens is you get fewer and fewer and fewer and fewer of those proteins. So now you have high blood sugar, but you have very few proteins that can bring that sugar into the brain. So they're bringing it in drop by drop, one at a time. And your brain's going, that's not enough. So what does the brain do? Increases your heart rate, increases your blood pressure. So you have the brain is starving. So it's going, well, I need more blood. And what does the brain do when it needs more blood? It raises your blood pressure. It's just a perfectly natural, that's the physiology of what is naturally going to happen. So when people have this syndrome of Alzheimer's, by the way, it's not Alzheimer's. Alzheimer's is a completely different issue. Alzheimer's, you're building up tau proteins and neurofibrillary tangles, and you have aluminum associated with it, and you're building up toxicity. And that is probably a different issue entirely. We just like to put any kind of dementia as just say Alzheimer's. But there's a lot of different kinds of dementia. You can have multi-infarct dementia from little strokes. There's different reasons for having dementia, and it's not all Alzheimer's disease. So this type 3 is not Alzheimer's. It is, that's why they want to distinguish them. That's why I want to say this is a metabolic dementia. This is type 3. This is a toxic dementia. This is Alzheimer's. That different issues, different causes, different underlying reasons for them, even though they may have the same manifestations. So as your brain is starving, what's going on? Well, your blood pressure goes up. And then people go, oh no, I'm going to get a stroke. This is horrible. My blood pressure is high. And what your brain, in order to lower the blood pressure, the best thing you can do is have a sufficient amount of sugar getting into your brain so that everything can function properly. So how do you do that? Well, it's so counterintuitive that it's even hard to believe. And that is by lowering your blood sugar, by stopping the sugar, by quitting sugar, by getting off the sugar, because you're sugar toxic. And that's what the toxicity does, is it decreases the glucose transport proteins, and diminishes the amount of sugar you can get into your brain. So what you want to do is decrease it in the blood. And this test has been done. I'm not saying this out of nothing. They took rats and they gave them insulin and dropped their blood sugar to about 40. And these were diabetic rats, dropped their blood sugar to 40. And 40 is really low. That's a really low blood sugar. And so what they did is they left them at 40 for several days. And the 3 days they're all laying around like, they're not acting rat-like at all because they have low blood sugar and nothing's working well. But on the fourth day, they got up and they started running around and acting like rats again. They checked their blood sugar. Hey, you're 40. They have low blood sugar and they're like acting normally. So they did a biopsy of the blood-brain barrier and they found 10 times the glucose transport proteins that allowed sugar to get across the blood-brain barrier into the brain. So that's what's needed. So people go, in fact, doctors and nutritionists and dietitians and the people that are telling you, they say, oh, you should never have low blood sugar. Well, you know what? Low blood sugar is bad, but you need it sometimes, especially if you're in the early stages of this type 3 diabetes. You want low blood sugar. You want the blood sugar to drop down so that you can start increasing those glucose transport proteins and get your brain functioning again. Does that make sense? So what are the signs? What are the symptoms? How do you know? Because you know what? Maybe you've never been tested. Your blood sugar's never been tested and your blood sugar's normal all the time. And yet you start forgetting things and you start not being able to calculate things very well, or remembering, gosh, why did I come into this room? I can't remember somebody's name that I know really well. There have been several studies on this. Dr. Dale Bredesen from UCLA did a really good study. 32 people, 29 of them, he was able to reverse their type 3 because it was a metabolic problem. And so he put them on a low glycemic diet. They had to go to sleep early. They did the 6-10 reset. They had to do tests. They were using their brain a lot. So they were exercising their brain. And then they had to do physical exercise. And then they took a bunch of supplements like CinnaChroma and Nervala and magnesium. They added magnesium in. So that kind of a program has actually been very successful in reversing. We're not talking about just not making it worse. We're talking about making it better, like people who couldn't work were able to go back to work and do their normal jobs. So you're going to worry and you're going to go into your doctor and you go, oh my gosh, I think I've got type 3 diabetes because I forgot what my dog's name was. I couldn't remember. Or I saw somebody, one of my old friends in the store, and I could not remember his name. Well, you know what? There's a lot of other reasons why you could forget things like that. It doesn't have to be type 3. But if this is a consistent problem where you're not thinking clearly, or you're, especially if those around you who know you really well are going, are you okay? You know, you're not thinking clearly, or you're not remembering things right. Because a lot of people who have this, they think they're fine, but the people around them are going, hey, there's something wrong there. That's kind of important. If somebody else is telling you that there's something wrong.
Right. Yeah. That's what my wife is good at. She'll tell me things that I'm like, no, like she'll say, like, I just told you that 5 minutes ago. I'm like, no, you didn't. Or like, you know, things like that. And then I realize, Okay, someone else told me the same thing, and I must not have been paying attention or something like that. But it's always good to have another person to give you feedback on different things.
Yeah.
Does my butt look big in these jeans? You know, you always want to.
It's not the jeans. I don't think that's how we want to answer, but
no, I don't think that's ever a good question for a husband to answer when his wife asks.
I also think this is really good information too. If you're someone who maybe hasn't even been diagnosed with type 2, or you know, you're not pre-diabetic, although most people are pre-diabetic, I believe. So it's good information for me too, just is even seeing people who have struggled with dementia and these types of things, and watching that happen to someone you care about is a motivation to make sure we're taking good care of ourselves. So
yeah.
I just appreciate all of this information and the reminders that our health is no joke. We have beautiful days here in South Dakota these past couple days. I'm in South Dakota as well. And I've just never been so thankful to be able to go outside to play with my kids, enjoy the warm weather. And if you don't have your health, those things are very difficult. So just a reminder that it's always a good time to start today.
Mm-hmm. Very true.
Mm-hmm.
Mm-hmm.
So with this type 3, women are more likely to get it than men. And it has something to do with the adrenal glands when, and there's a lot of women that get adrenal abnormalities like high DHEA, and it's something called PCOS, polycystic ovary syndrome. And just having that PCOS predisposes or increases the risk significantly for metabolic dementia. It also increases the risk for diabetes, but what's really interesting is it doesn't always create diabetes, but rather insulin resistance. And part of the reason for that is because it's not a real pancreas problem, it's an adrenal problem. But the high adrenals make you resistant to insulin. So that creates an insulin resistance. It's kind of an artificial insulin resistance that women can get, which is why they're more predisposed to getting this dementia than men.
Is PCOS a genetic issue, or what? Where does that come from?
It's probably mostly genetic. We deal with it with diet and exercise and supplements, and we balance the hormones. But it's the predisposition is definitely genetic.
Okay, interesting.
So there's that kind of genetic component to the dementia too. The Alzheimer's has a certain genetic component, but you know the Alzheimer's, the toxic actual Alzheimer's, where if you biopsy, you can see the neurofibrillary tangles. That it has a very small genetic component, but people do tests and they do their genes and they do like the 23andMe or the whatever, all those other genetic tests. Mm-hmm. And they say, well, you have the Alzheimer's gene. And everybody's going, oh no, I have the Alzheimer's gene. This is horrible. I'm going to get Alzheimer's. It increases your risk of Alzheimer's by like 4 to 10%. It's not like they're going to get Alzheimer's because of it. It increases the risk and not even very much. So if you have multiple, then, you know, some are worse, of course. But there are ways around that. And you can decrease your risk by much more than the genes increase your risk by taking care of yourself in the same way. It's the same thing that we do in the diabetes reversal program. And if you look at Dr. Bredesen's program from UCLA for reversing Alzheimer's, it reads kind of like the Barton Publishing Diabetes Reversal Program. It's a very similar thing. Because when you have that metabolic problem, when you have that high blood sugar, insulin resistance, it's creating fewer and fewer of the glucose transport proteins to get sugar into your brain. Or, you know, people get kidney disease too for the same reason, neuropathy all over their bodies. They get liver disease. But The treatment is always the same. This is sugar toxicity. This is glucose toxicity. And so I told somebody the other day, I said, well, you're toxic on sugar. She said, I don't even eat sugar. I'm like, yeah, but you have rice? Oh, yeah. You have bread? Yeah. Corn? Yeah. Potatoes? Yeah. I said, that's all sugar.
Yeah. So question, I mean, the brain is one of the, like, probably the most important organ, I would say, that we want to protect, because like we talked about, if you lose your memory and your brain and all that, it just can be very frustrating for yourself and for others around you, and you lose function, you know, vital function there. So can you talk about, like, we'll get into like nutritional things and other things, but like how important is it to stay active mentally, as far as like, you know, doing things with, maybe it's your work or something you're, you know, very, you know, active in as a hobby, or involvement in a community or something like that. Like what role does that play in type 3 and Alzheimer's and dementia?
Apparently, it's very important. So many years ago, over 20 years ago, when UCLA had, in the brain research center, they had all these brains that they'd collected, and they started biopsying all the brains, and they looking under, and they going, oh, Alzheimer's, Alzheimer's, Alzheimer's. You know, they were seeing a bunch of people with Alzheimer's. They went back to the family and said, you know, your grandmother had Alzheimer's. And they're like, no, she didn't. She was like sharp as a tack till the day she died. And they're like, wow, what? But they have like all of the pathology in the brain shows Alzheimer's, but they were thinking perfectly clearly. It just doesn't make sense. Apparently, exercising the brain, keeping it active, is what it can keep it going, even when there are physiologic changes that aren't ideal. The brain can repair, but it repairs in a funny way. There was a book by Deutsch called The Brain's Way of Repairing, The Brain's Way of Healing, The Brain's Way of Healing. And he talks about various brain things, including like Parkinson's disease. He has a good example of Parkinson's disease where this person had pretty bad Parkinson's disease and was mostly non-functional until he started walking. And he would walk, and he walked more and more and more until he got really good at walking. He'd walk fast. And he got to, I forgot, like 3 miles or something like that a day. And as long as he was doing that 3 miles a day, he didn't manifest the symptoms of Parkinson's. Then things happened where he couldn't do his walk. And so because he couldn't do his walk, he started getting the Parkinson's back again. And so then he had to get back on the track and start walking again. He got up to 3 miles a day and he was okay as long as he was doing that exercise. The brain's way of healing is not like by getting back what you had before. It's by working around what you have with what you have now. So if you have some damage to the brain, some metabolic problems with certain areas of your brain, the brain can switch over and say, well, we can't use that area, so we'll just park everything in this area and use that instead. And that's where we'll access that, and it can function normally with less than a full brain. You know, they tell you use only 10% of your brain in your whole life. That's not true, by the way, but it's not like the potential of what's there is much bigger than what we actually use. So yes, Joe, that's a great question. Keeping your brain active. And here's some things to think about. Learn a new language. I don't care how old you are. Learning a new language is great. Take up a musical instrument. You know, learn to play the piano. Get a ukulele. You know, just pick up a musical instrument and learn to play it and practice. As you're practicing, you are using your brain, just like the guy with Parkinson's. You know, as long as he was walking and getting better at walking and staying in um, uh, a good amount of walking and practicing, the brain was able to work around his Parkinson's. And it's kind of like that. And Joe, you should get a guitar or something.
I should. Wow, it's really out of tune. ¿Dónde está mi guitarra, por favor? So I'll be tackling 2 and 1. I'll play my guitar. Oh yeah, I got to tune this baby. But musical instrument, speaking Spanglish, right there, keeping my brain sharp. Yes, you're welcome. Free entertainment today, everyone. This would probably be a good segue for me to do a little Q&A, or not Q&A, housekeeping. So just to tell people, welcome to the Barton Fixed Blood Sugar webinar. I'm your host, Joe Barton. I didn't go over this a half an hour ago when we started. But if you are wondering, where can I find more information about what we're talking about today? The Diabetes Solution Kit, which is right here, pull it out of my guitar. This is available on bartonwebinar.com. And links to, this is our best-selling book that we've sold close to 1 million copies now. And you can also find out about the products that we talked about. So Dr. Saunders mentioned CinnaChroma, which is our best-selling blood sugar support supplement, and Nervala, also for nerve pain and many other things. We're actually having a sale, a warehouse sale. You may have seen our emails. Today, Nervala is on sale for our lowest price ever. If you check your email, there's an email that says warehouse sale, something like that, 50% off. And so if you want to get a bunch of Nervala, today's the day to do it. We could probably post a link in our chat as well. So I don't want you guys to miss out on that. So I'm going to pop that in the chat here real quick. I think I copied it. Boom. And there it is. Leslie, if you want to share that on YouTube and Facebook as well. But yeah, the purpose of these webinars is to help people with type 2 to reverse it using natural remedies. Dr. Saunders is an expert in that area. We've been doing these webinars for over a year now. We've got all of them archived in our YouTube channel. Lots of great information. Every other week, we basically stick to the bare bone basics. We cover, the nuts and bolts of reversing type 2. And on the other weeks, we usually pick like a topic. And today is type 3. And so, but we also do take time every week to answer questions. And Randy has a great question that I think would be a good segue here. You talked about symptoms of type 3 diabetes. What about symptoms for type 2 diabetes?
Well, that's a great question, because sometimes it's like the same thing. Sometimes there's no symptoms at all. You don't even know it. Some people have frequent urination where their blood sugar is really high, and so the sugar spills into the urine, and so the water goes with it, and so they say, like, I'm getting up 10 times at night to urinate, and I just can't stand it anymore. And so that may be one symptom, but it's not really that common for people to get that early on. Early on, you might have no symptoms at all. I think testing is very useful. Okay, so let's look at other symptoms. Weight gain. People who say, gosh, you know what? I am putting on fat and I can't get rid of it. And I'm like, I go to the gym and I work out like crazy. I had one of my CrossFit coaches who came to me and he said, I'm working out all day long and I'm doing abdominals and I'm doing sit-ups and crunches and I cannot get my six-pack back again. It's like I got this little poochy belly and it won't go away. So I said, well, what do you eat? After class, what do you eat? And he goes, well, I go home and I have my protein shake. He told me what was in it, and I'm like, oh my gosh. So he's putting like eggs and this protein powder, and it's got juice in it, all this fruit and stuff. And I'm like, okay, don't eat that at night. Just eat it in the morning instead. Mm-hmm. And then because he doesn't eat during the day a lot. He doesn't like go out. So So I said, just go to bed on an empty stomach and then do it in the morning. And within a month, he was going, look at this. You know, he'd lost that poochy belly.
Yeah.
So having belly fat, that's a symptom of type 2. Gaining weight generally without being able to lose it very well, that's a symptom of type 2. Sometimes people get hypoglycemia, low blood sugar, as a symptom of type 2 because their blood sugar goes up and their insulin goes up dramatically because they're insulin resistant. So they have a really high insulin that drops the blood sugar down, and then they go, oh, I feel so weak. A half an hour after I eat, I'm so weak and tired, I have to go to bed or I have to eat something, and it's terrible. That kind of thing could be a sign of type 2 as well.
Quick question. So hypoglycemia, that's been in my family. I've had it off and on. I remember when I was younger, and my dad has had it a lot. But is that pretty typical for somebody with type 2? Like, do you see more people with type 2 that also have hypoglycemia, or what's the correlation there?
Yeah, early on, early sign of type 2, when the insulin is high, but you're not very resistant to the insulin. So the insulin goes up, and what insulin does is tells all your cells to bring the sugar out of the blood, to suck the sugar out of the blood. So then the blood sugar goes and drops down. So early on, before somebody becomes really resistant to insulin, hypoglycemia is fairly common. I've noticed that.
Yeah, my dad would call it having a spell, and then he'd have to lay down, and someone would have to get him some sugar, orange juice or something, just to get his sugar back up. So yeah, definitely a symptom that there's something going on. Erratic blood sugar, we might call it. So we have our friend anonymous attendee is with us today as well, and their question is, doing crossword puzzles and search words, are these good management tools to keep your brain sharp?
It turns out that in research, probably not. They're okay.
Really?
Yeah, but that's all based on recall and association. There's nothing new that's being learned. There's nothing that is being practiced. So there was some research on that I read a few years ago about how that those crosswords are not as good as they thought they should be for preventing dementia or staving off dementia.
Something I've heard that works well is like writing with your non-dominant hand, even if it's just doodling, but like trying to do things differently. Like it does something with your brain, the left, right side, different things like that. Have you heard about that?
I haven't heard about that specifically, but anything new that you're learning that's different, that's really helpful, because that's where your brain is increasing and growing and able to get around whatever's missing.
Another fun exercise that's relevant to today is find a friend who has different political views than you and have a meal and switch your opinion. Like argue for what you actually don't agree with, and tell the other person they have to do the same thing. So,
that's for that very reason, I would never go to law school. In law school, they require you to do stuff like that.
Really?
It's like, no, I can't argue somebody else's opinion. That's I'm just too opinionated.
Yeah. Well,
Joe, you're not on Facebook, so you didn't get to see my fun meme that I shared.
Oh man, yeah, I've been off Facebook for almost 3 weeks now. What was it?
I wonder if I can show you.
Yeah, I think you could share your screen.
Survival tip. If you get lost in the woods, start talking about politics, and someone will show up to argue with you.
Yes, that's good. Okay, let's see. We had a couple more questions coming in, so keep the questions coming. Good stuff. All right, James.
One on Facebook too.
Okay, James says, I've got calcification in lower extremities with flow limiting stenosis. How can I get rid of this or keep it from progressing any further?
Oh my goodness. Yeah, that's important, because that doesn't get better unless you fix it. And so Yes, you need a plan to fix that. And there are various ways of doing it. I had somebody who was so bad, he had chest pain so bad, his arteries were so clogged with calcification. His number, normal is 0, up to 100 is considered okay. His number was 1,200 for just his heart. And his cardiologist said, there is no way you're going to live for a month if you don't get a bypass surgery. And he goes, I don't want a bypass surgery because I know it destroys my brain. So he decided that he was going to fast for 30 days, water only. And he did 30 days with just drinking water. And in 30 days, he was able to play a full game of tennis with no chest pain. And he continues to this day. A year later, no chest pain at all. He can do anything he wants. Basketball was a big thing. It was really hard for him. But, you know, he's 70 years old and he's playing basketball, playing tennis, and he's fine. I had another man who came in and said, and with peripheral artery disease and calcifications, and was told, you know, you're going to lose your feet if you don't get these bypass surgeries. And he says, I don't want the surgery. Is there any other way? And so we put him on a diet, a low glycemic diet, just like the diabetes reversal plan, diabetes solution kit. And at the same time, I did a series of chelation treatments, EDTA. EDTA chelation is called a chemical endarterectomy. What that means is you're taking the plaque out of the arteries with chemistry, and that is, if you've ever heard of EDTA, it's an amino acid that holds on to calcium. It binds calcium. They put it in a lot of foods and cosmetics and stuff. It's an amino acid and it's benign, but we don't use it like for proteins or anything. So when you get it in your body, your kidneys just go, oh, I don't use that one, and gets rid of it. But what's cool about that is it grabs on to like calcium deposits and lead, heavy metals, and then so they get excreted in the urine with the EDTA because the kidney doesn't keep it. So those are two things that has to be dealt with when you have peripheral artery disease. If you don't deal with it, it does lead to neuropathy and amputations because you have to have good blood flow to all the way down to the tips of your toes, or the infections show up, neuropathy shows up, you lose feeling, you don't know it's infected. And before they know anything about it, you've got a bone infected and now they can't heal it because there's not enough blood flowing to it. And so they got to cut it off. So that's important.
I know I saw in the news, Senator Mitch McConnell was being, I guess you could say, getting some public attention because of his purple hands. I don't know if you saw that, but they looked very purple, like deeply bruised or whatever, and he's probably in his 70s, I'd imagine. But what typically causes something like that where both of your hands are like 80% purple?
Well, that might be a different issue. Stress can cause constriction of the blood vessels, and your hands can turn blue or white because of just a lack of blood flow, circulation. There's another phenomenon called Raynaud's, where the arteries kind of close down, and so it decreases the blood flow to the hands. Specifically, Raynaud's is in the hands, but it can happen in the feet. It can happen anywhere. People get it in their heart. 60% of heart attacks are just the blood flow decreasing to the heart. And it's a brain thing. It's not really a cholesterol thing. Everybody thinks it's cholesterol. Cholesterol is a big hoax, by the way. So the purple hands could be just a constriction of blood flow and not peripheral artery disease, but that's another possibility.
Okay. All right. So Marilyn, this is a great question. Does diabetes medication cause depression, and or what other side effects?
Okay, it depends on the medication. Diabetes medication affects your metabolism. So it can affect anything. Metformin, I was just reading about metformin. They just found out that prevents your liver from making new glucose, and it blocks a certain enzyme that could build up lactic acid and cause toxicity. And some people do get lactic acid toxicity from it. And so that toxicity can cause a lot of things. So the medications themselves, because they are toxic, they can affect how your pancreas works, your liver works, and then of course how your brain works. So a lot of them increase insulin, make more insulin resistance, which can prevent those glucose transport proteins and create more Alzheimer's. And when your brain's not functioning well, what's the first thing that happens? Depression, anxiety. Those are actually normal responses that the brain has to something's wrong. And in this case, something is metabolically wrong, but you still get depression and anxiety. The default of the brain is to look for problems and danger. Your brain's always looking for danger. If you're not focused on, I'm doing this right now, then and you're just letting your brain go, then it will automatically look for danger around you. It's part of it. And what's that going to create? Anxiety. Mm-hmm. So some of the medication, some of diabetes medications can do that dramatically, but not everybody has the same effect. So it's not going to be automatic for everyone.
Yeah. Okay. All right. So Marilyn had another question. This is probably more for me. Why do you send emails quite often that ask a question with no answer? In other words, for example,
I want answers, mister.
The other day, which of the following 5 foods are the worst for diabetes? So typically, our emails, we do send out information from either our own products, other products that we have, or friends of ours that have products that are related to blood sugar, diabetes, different things like that. And so those types of questions are really just good marketing because it gets curiosity. Just being honest, it gets your curiosity and you click on it and it's like, all right, I need to go find out what are the 5 worst foods for diabetes. And then there's usually like a presentation or a video that you watch and it answers that. But I can see how that can be frustrating sometimes, but that's typically just, marketing 101. But hopefully they are providing good, valuable information at the same time. So
what are the 5 foods? She wants to know what the 5 foods are.
I know one is donuts, French fries, donuts. I'm trying to remember.
Soda.
What's that?
Soda.
Yeah, soda, whether it's regular or diet soda.
Or diet. Diet might be worse.
Yeah. Fruit juice, that's another thing. Typically things that are super high carbs, high sugar, low fiber, low fat, low protein. Cereals, yeah.
I think cold cereal is a huge one. I find that more than anything else.
Yeah. No, I know. That's hard when it's late at night. It's like, I need something fast, and you'd have less willpower to say no. Sometimes that can be a not so great choice, but yep. All right. So Leslie, you have some other questions from Facebook and elsewhere?
Yes. Okay. So this has come up a couple times. This is a question from Louis. I would like to know, is there any cure for ED?
That's an excellent question. Did we do an ED, or are we going to do that?
I think we did once, but we'll have another one in a little while.
Yeah. Well, okay. There are plenty of cures for ED, but you have to find out what the reason is. So if you have hypertension and you have vascular disease that's causing your erectile dysfunction, then you have to deal with that, first. If you have certain deficiencies like magnesium, zinc, can cause low testosterone, then you have to deal with that. If you have high stress that's preventing you from getting an erection, then you have to deal with that. So there's a lot of different reasons, and you take all of those physical causes together, and they make up like 15% of why people have ED. The other 85% is a mental block. So there's so much more to ED that we should do like a whole, I don't know, series on it or something.
Yeah, that would be good. And metformin, yeah, is one of the leading causes of that. So another side effect that comes with that. So yeah. Ernie had a good question a little while ago. Leslie, if you want to tackle that one.
You bet.
Actually, real quick. No, never mind. Go ahead.
One other quick question before I get to Ernie's. Someone on Facebook had said, you know, we're talking about type 3 diabetes, but how do we reverse type 2?
Okay. Having the diabetes solution kit helps us to understand the sugar toxicity that causes type 2 and type 3. So if you were toxic on lead, what you would do is you would search out all the sources of lead. You'd look in your house, you'd test your paint. They have those paint testers. You'd go into your work and go, okay, where's the lead coming from? I want to stop the lead from getting into my body, number one. And then number two, I got to get all this excess lead out of my body. So chelation of some kind to get the lead out. Get the lead out. I've heard of that. Those are the exact same two things you're going to do with sugar toxicity. So you're going to say, where's the sugar coming from? Is it eating rice with every meal? Is it having French fries or potatoes or cold cereal is a big one, and sugar and corn and whatever, sweet sodas, juice, fruit, whatever. You're going to look for all the sources, and then you're gonna get rid of those so you don't have all this excess sugar come in because you already have too much. And then you're going to use up what you have. So you're going to start, exercising and doing stuff to use the sugar. And when you do that, then the toxicity level drops down. You get down to a normal level, and then your body can function normally again. It's just physiology, basic.
Somebody asked, what is our customer support and health coach phone number? And that number is 888-356-1146. That's 888-356-1146. Boom. It's funny, we've been getting phone calls to our home every once in a while because I think certain people with their credit card statements, they click on that number and for whatever reason, it comes to our home. It's like, we have an outgoing voice message that gives them that number and apologizes for that, but it's kind of fun.
Okay, Ernie's question here. Ernie, welcome back. Let's see. My insulin resistance is 19.2. How severe is this, and can this number come down?
Insulin resistance index 19.2. Is that the index? That's really high. Gosh, 3 is high, 19.2. But if that's hemoglobin A1C, that's really high. I don't,
right? Yeah.
I don't know what the 19.2 means. Yeah. Okay, it's so not.
Feel free to send us more information, Ernie.
It's not hemoglobin A1C, but if you have really high insulin resistance index, if your fasting insulin is 19.2, okay, all right. So you're definitely resistant. The optimum place to be is around 5. So 3 to 7, less than 10 is considered normal. Over 10 is considered high on a fasting specimen. Up to 19 is considered normal after eating, but on fasting, that's still high. So the way to get it down is to shut off the insulin. So you shut off insulin when you avoid proteins and carbohydrates. So if you eat fats, okay, and fiber. So high fiber things like broccoli and cauliflower and spinach and lettuce and salads, that kind of thing. And with fats, so you can have olive oil and coconut oil and that stuff on your salads, and put butter on your broccoli and that kind of thing, and avoid starches, sugars, and be careful of proteins, because proteins cause the release of insulin as well. So having an empty stomach also helps a lot. So if you leave time between your meals, like have a meal, wait at least 4 hours, 5 hours, and before your next meal, and then 4 or 5 hours before your next meal, or eat just 2 meals a day, then you have an empty stomach for a longer period of time. The 6-10 reset that we do is partly to help that, so that you stop eating earlier in the day and you don't have anything after 6 at night. So, oh, good work, Ernie. 6-10 reset. Keep doing that. So if you want to get your insulin resistance down, then just drop it back to, like, don't eat after 3 o'clock. And this research has been done. Dr. Sachin Panda did the research on that. And he said when they moved it back to 3 o'clock, they got a much better response, the insulin response and weight loss and all of that.
Okay, I'm going to send you his second question here. So it'll come up for you, Dr. Scott, because I'll have you read it, because it's a lot of numbers and things I'm not familiar with.
I have a really good renal panel. Is that it?
Yep.
Microalbumin, yeah, 60. Okay, so kidney function is compromised. Can this be reversed? Well, we're not sure about reversing it, but stopping it from getting worse is definitely possible. And you do it the same way. It's the same thing. Your kidneys are not getting enough energy. Your kidneys need energy. They need to reproduce. The cells need to repair and fix and be able to replicate. So in order to do that, they have to have enough energy. And so to give them energy, the irony is you want to drop your blood sugar down. So the 6-10 reset would help. Having an empty stomach would help. And the diabetes solution program is also going to help. Those are the kinds of things that will help you reverse that. I had somebody that had a metabolic kidney problem, diabetes with kidney disease, and I put her on a ketogenic diet, which is essentially phase 1 of the diabetes solution kit. So she was on phase 1. She was measuring her ketones; they were consistently elevated, and her kidney function did come back to normal. Yeah, so it's possible.
Awesome. Let's see. I'm going to do this question here from Paul. What was the 4-letter substance you referred to before, which binds with calcium and helps to reduce calcification? How does one use that?
EDTA, ethylene diamine tetracetic acid. It's found everywhere, but it's kind of hard to get, because if you take it orally, we don't use that amino acid, so it just gets you just excrete it. You don't absorb it. So in order to get it, you actually have to get it IV to get significant amounts. I had somebody that did that. He had really bad peripheral artery disease. He couldn't walk across the street without getting cramps in his muscles, and he had to stop and wait for the blood to get there. So that he could have some energy in the muscle, so that he can continue the rest of the way across the street. And so, but by the time we did EDTA IV, intravenous IV treatments, 30 treatments, 1 a week for 30 weeks. And by the time he was done, he was taking a dance class. No problems. He could walk anywhere, do anything, and he did great.
Awesome. Okay, from Sani, would chelation treatments be good for blood clots?
No. Chelation doesn't really work well for blood clots. The clots are forming because of usually inflammation of some kind, and that's not uncommon with diabetes. And so preventing the clots is the best thing. But if you already have clots, there's something called nattokinase. Natto is a soybean curd, and the nattokinase is extracted from it, and it's an enzyme that actually dissolves clots. And so it's very useful. So nattokinase to dissolve clots, and if you want to prevent clots, you can use fish oil. Is pretty good for that. Omega-3 oils and garlic and vitamin E. And the vitamin E would be about 800 units a day.
Okay, Krish is back. Here is a question. In terms of anti-diabetic drugs, what is the better alternative to metformin? Can CinnaChroma be taken along with metformin for some time with the consent of primary care physician?
Yeah, CinnaChroma will not interfere with metformin at all. They work totally different. And metformin's not a bad choice. And if you don't want to use metformin, don't use anything at all. I mean, you don't really need them, because if you think about it, a lot of the alternatives increase your insulin and cause you to bring more sugar into your cells and make them more toxic. And cause your brain to be more insulin resistant and all of that. So the idea is that when you get on phase 1 of the diabetes solution kit, what that does is drops your need for insulin. If you're not taking in any carbohydrates, your need for insulin drops down dramatically and very quickly. So it'll be so much more effective than using a medication, any medication, especially insulin. Insulin, remember, is not a type 2, is not a medication that's useful for type 2. It's really only for type 1.
Okay. Robert had said that you mentioned cholesterol. Can you expand on that?
That might be a good topic, actually. I was just searching our webinars in the past, and we haven't specifically addressed that. So what do you think 2 weeks from now we talk about cholesterol?
That's a good idea.
Okay. Yeah. I agree.
But it's really like inflammation is the bigger issue, right? Just in a nutshell, if you were to.
I think you said it's a hoax.
Yeah.
Oh, right. That's what I said. I said
yeah.
Cholesterol's a hoax. Yeah, there's a really good book by a doctor in Scotland who wrote a book called The Cholesterol Hoax. And he has he's researched this extensively and looked at it and said, none of the research that's done well supports the cholesterol hypothesis. And yet they've been going on that. They used this one study from Massachusetts since the 1950s. They've been using this same study, but then created a lot of theories, and the theories were perpetuated without ever being validated. And so, but all the research didn't validate it. Anyway, it's a really good book, we can put that up. I'll show you what that is. Or next time when we talk about it, I'll bring it up. I'll bring the book.
Okay, question from Krish. Is there a link between type 2 diabetes and onset of glaucoma or worsening of that eye abnormality? Besides 2 to 4 different drops of eye medicine to reduce IOP, what can a subject do to reduce it? Thanks.
Okay. Glaucoma is an increased intraocular pressure. There's reasons for it, and it may be related to a metabolic problem such as diabetes. When you're not getting enough energy in, you can have edema or swelling, and you get edema in the back of your eye, of the retinal edema from diabetes. And you can also get the excess in your eye, and that would be glaucoma. So that's a potentially a big problem. But can you do anything about it? You know what? You've got to work with your eye doctor on that. You don't want to mess with glaucoma and just stop your medications. But the first thing to do is get your insulin down to normal, get your blood pressure down to normal, because if the blood pressure is normal, that means your brain's getting enough oxygen and sugar and all the nutrients that the brain needs. So then the brain's not going to push your blood sugar up to get more circulation. So once your blood pressure is normal, then you may see your eye pressure drop down, but you work with your ophthalmologist on that. You can't just walk around with high intraocular pressure, IOP, and say, oh, it's no big deal. It is a big deal. Blindness is not a small thing, and it's very common with diabetes.
Mm-hmm.
In fact, the most common cause of blindness is diabetes type 2.
Hmm. Yeah. Somebody asked about, so they live in Toronto and wondered if there's a doctor that practices alternative approaches to treating type 2 in Canada. And so typically what we usually say is either look for somebody that practices functional medicine. That's kind of the key word to search for. Or Dr. Saunders, I believe that you can have like doctor-patient relationship virtually, right? With people, if they call your phone number, they can set up, explore that further, and you can, yeah.
I have people all over the United States, but I don't have anyone from Canada. I don't even know if they have any laws against that. I don't know.
Yeah, I might have to look into that. So,
but if you find anyone in your area that does like integrative or functional or anything, and they're not quite right, ask them, because they all know each other. We all go to the same conferences, and I've seen a lot of people from Canada there. So I know there's plenty of functional doctors in Canada.
Yeah.
And the ones in your local area are going to know, who the other ones are.
Mm-hmm. Yep. Good. Same person asked, why did you move away from conventional medicine?
Oh, no, I still do conventional medicine. I just, some people I put on Metformin. I use antibiotics all the time. I'm medical director of a nursing home. I probably have more prescriptions under my name than most doctors do, because I have a lot of nursing home patients that, long-term care patients that are on lists of medications, 10 and 20 long. What I do is functional, and that is to restore function. And so it's a this is good for that. So like, if you have type 1 diabetes, you need insulin. If you have type 2 diabetes, you do not need insulin. And so there's a lot of mistakes that are made that doctors don't know the difference between type 1 and type 2, so that they just kind of put them together and say, oh, diabetes, okay, you need insulin, without thinking, oh, that's type 2. That's the opposite. They're too much insulin. They got to get that insulin down. So I just do restoring function, whatever it takes. If it takes a drug, I put people on Lipitor like 4 times in 20 years, because I said, you need Lipitor, keep taking it.
Interesting. Yeah. But for the most part, you do try to find, like, you're all about finding the root cause and treating that, and not just treating symptoms, right?
Exactly. And
yeah.
that's the point. Instead of just treating the symptoms, which blood sugar is just a symptom of diabetes, it's not the problem. The problem is insulin resistance. That's what you got to treat.
Yeah. Well, lots of good questions today, and lots of comments thanking you for your help as well. And we are at that time. So any last closing statement you want to give us here before we sign off?
Okay. So for dementia, a lot of people I know you're going to worry about, you're going to go, oh my gosh, I forgot why I came into this room. I must be getting dementia. If you think that you don't have dementia, the people that are getting dementia are the ones that they keep going along and they're not even aware that they have an issue. That's why I said, if other people are telling you, hey, something's wrong, that's a good reason to make some changes.
All right. Well, excellent. Thank you, Dr. Saunders. Thank you, Leslie.
Welcome.
Thank you, everybody, for joining us here. And again, if you want more information, just go to bartonwebinar.com. That's where everything is at. Our products, our webinar links on YouTube, and our Facebook page for the 610 reset. So yeah, we'll see you guys there. If you haven't voted yet and you're an American, do your duty. Get out there. It's a beautiful day. And we'll see you guys next time. God bless. Bye-bye.